This video will teach you the thoracolumbar soft tissue prone OMM technique. And this technique is one of the high yield, big ticket items for your practical exams in OMM or OMT. What you want to have is a patient laying prone, and you'll be working on the patient's opposite side along their thoracolumbar region, hence the name thoracolumbar soft tissue prone. You want to take your caudal hand and feel around the patient's hip for their ASIS, their anterior superior iliac spine. Now this may be ticklish for some patients. My patient seems to be doing okay. But if it is ticklish for them, one trick to try and get them past that is to have their arm on the same side, come back and put their arm either near yours, under yours, whatever's comfortable for them. It's just something about if it feels like they're the ones that are touching that area, they don't get as ticklish. I can't explain it. Then with your cephalad hand, you want to place it so that your palm of your hand and the base of your hand are on those paraspinal muscles, paravertebral muscles, because the purpose of this technique is to free up the quadratus lumborum, also known as the QL muscle, that paravertebral musculature all throughout the thoracolumbar area, free up ribs 11 and 12, and just really trying to relax these muscles and get them to work out any somatic dysfunctions they may have. So with your caudal hand on the ASIS, and the base of your hand, right along next to those spinous processes, right along that paravertebral musculature, you're going to work in a kneading motion, which is the same thing we've used in a few other videos. So we're going to find the ASIS and we're going to pull up on it, posterior lateral on the patient, and at the same time we're going to be working our cephalad hand out. So it'll be much like this, and I'll show you. Caudal hand on the ASIS, cephalad hand on that paravertebral musculature, and I'm just pulling up with the caudal hand while I'm pushing down and out with the cephalad hand. You really want to get into a rhythmic motion, an oscillating motion that works up and down the patient's back. You can go a little bit slower, you can go a little bit quicker. Really, so you want to go at a speed that you can diagnose and feel somatic dysfunctions if they do arise, and that you can appreciate any sort of fascial or musculature release. So right now I'm feeling the paravertebral muscles really loosen as I work up and down the patient's back. You want to do this for about 20 to 30 seconds until you really can tell that there's been some release in the patient's musculature. And again, you want to work in a rhythmic motion, in a kneading motion, with your hands working in opposition. Working together, but in opposite directions, I should say. And this is the thoracolumbar soft tissue prone technique. A big one for practicals.